Hello, travelers. Thank you so much for joining me, travelers and nurses, and future nurses, and ex nurses, and soon to be travelers, and new grads, and all in between. Thank you. I just want to talk for a few seconds. Uh, Two quick things, and I guess my talks are becoming more and more ER focused, which makes sense because ER is what I know. But I also try to bring up another topic always, which is travel related in general. So, for the travel related in general topic, I want to talk about these horrible rates that we're seeing across the country. Yes, a lot of the nicer states, southern states, Florida in particular, Texas, Georgia, they pay lower year round, but especially now because it is not their season, it's not their busy season. But I think around the country we are seeing some pretty low rates. Those of you who've been traveling for years are sitting back on your stacks of cash, telling all of us not to accept these rates. That's very cute. People have bills to pay, and you you may be able to sit back and not accept these rates, but some of us have to work. I am the provider in my home. I gotta work. If we don't work, I don't eat. So either I take those rates or I go back to staff. So stop telling people, please. It really irks me when I see. I'm in a lot of like Facebook groups and Reddit, travel nurse groups. And I was, oh, all these new travelers, if they would just stop taking these rates, what is the alternative? Okay. Not everyone, like I said, has been traveling for the past 5 years and has a six-figure stash to sit back on. Some of you do, some of us do not. So unless you are willing to start a GoFundMe for the nurses to not accept low rates and to still pay their bills and keep their lights on and keep food in their fridge and keep, roofs over heads and children in private school, by all means comment. But if you are not willing to part with some of your hard saved stash, please let people decide what contract is right for them. Okay. That being said, there are some very insulting rates out there right now. And please know your worth. I won't tell anyone not to take a contract, but know your worth. Okay. I've been doing this a little over a year now, about a year and a half. Experience traveling, 12 years, an ER nurse. Now, I want to say one thing, maybe two things that I think can help you either A, secure your rate if you're worried about them dropping it, or B, secure you getting an extension at the facility you're working at. If you want to stay there and you like what you're getting paid, take heed. So, as soon as you get there, you feel the place out. I mean, we know, those of us who have been doing this for a little bit, if you've taken more than 2 contracts, I'm assuming once you get to your assignment, you know within a week if this is someplace you could hang your boots up and get comfortable, or if you're like, all right, and I have 36 shifts to go. Right? You know from the second you step on the floor, you catch that vibe, you meet your other nurses, your coworkers, your techs, your staff, whatever. You know whether you want to stay or not. So if you like the place and if you like your rate, reach out to your management as soon as you can. As soon as you realize this is something you want, as soon as you realize you might want to stay here, you reach out to HR, to your manager, to whoever's doing your contract, and you tell them you would like to extend. If you want more money, ask for more money. If you're comfortable with the same rate, make sure you ask for that same rate. Okay? The reason I say this is I'm speaking from experience. My current contract asked me to extend about 4 or 5 weeks in, and a few of the staff members were actually kind of surprised, like, damn, they already asked you to extend that quick. Well, I'm glad they did, because about 2 or 3 weeks after I signed my new contract, they lowered the internal travel rate pretty significantly as well. But they are saying they will honor all signed contracts. So That's what I'm saying. If you have already signed your contract, there's a chance that you'll have a leg to stand on if, in fact, they do start lowering your rates. Okay, so try to extend as soon as possible. Try to secure your rate, and the second way to really secure an extension, it's the easiest thing. Are you ready? Put down your phone. Put down your phone. It sounds so easy, and I probably sound like an asshole for saying that. Sorry, Mom. But put down your phone, because when you are on your phone, you're not getting anything done. You look lazy. If you're a patient just walking by and you're seeing someone on their phone, I mean, it's not a good look. If you need to go on your phone, you need to text them, go in a break room, go in a supply room, go down to radiology and sit down there for a minute and talk to your girls in x-ray and get on your phone. I try to be very minimal with letting people see you on your cell phone. Not only does it look good, but it also helps you get more work done. You're not sitting, you're not stagnant, you're not sedentary, sitting here looking at your phone. You're up doing things, you're up stocking, you're up helping people. If you're caught up in your assignment and your coworker has something going on, put down your phone. Get up, take a few minutes, take 5 minutes to go help a coworker. You never know what that might do, what kind of impression that might leave. Put the phone down, put the phone away, and get your work done. Put your nose to the grind and get your work done, and that will guarantee you that offer for extension. I people at work tease me because I don't really sit down, but my answer is, I'm on an internal contract, and these things can come and go as any contract can. So if the census drops and they're looking to cancel 2 or 3 internal nurses, I need to make sure my name is not on that list. If your name is on it, that's too bad. If you've been on your phone, if you've not been helping, if you've been sitting, being lazy, that's too bad. I'm here to outwork you. I'm here to outshine you. Oh, yes. And I'm here to make sure that my contract doesn't get cut. All right. So if you're sitting there on your phone and you're looking at TikTok or Instagram or Facebook, whatever, or you're texting people, and then when cuts come around, you're wondering why you got cut and so didn't. Okay. Put the phone away. Travelers, put the phone away. All right. Now this specifically for my ER people, and I guess I'm med-surg if you're irrigating bladders. You may irrigate bladders. This is weird. I'm doing a weird transition. I'm going to talk a bit about CBI. Continuous bladder irrigation. Yeah, we hate it. We hate it. It's time consuming. It's messy. It's usually uncomfortable for the patient. And it's rough for family to watch, right? So quick couple tips that I found, some of them from watching people on YouTube, some of them from watching coworkers, and some of them along the way in my own experience. First things first, you're going to need a lot of chucks. You're going to need a lot of 4x4s. Make sure you don't underestimate and you have at least 2 packs of 4x4s and a few packs of chucks with you before you even begin to do anything. All right. Now, after you've inserted your catheter, please, ER nurses, urologists and urology nurses get very upset when we put that 3-way in. We have our big bags, we hook our bags up, and we let it flow. Why? The clots in the bladder need to be agitated a bit. You kind of got to work them up a little bit, or else you're just having that saline kind of slip along those clots in the inner wall of the bladder, and they're not really grabbing any of them. So you need to really irrigate that Foley, I would say, for a good 10 or 15 minutes. If your patient can tolerate it, you got to give it that nice push-pull action. Be aware, you're not trying to spasm or collapse anyone's bladder, right? You just want to make sure you're getting back what you're putting in, all right? If your patient's complaining of any kind of pain or discomfort as you're instilling that water, you have to be very aware that you are not overinflating anyone's bladder. We're not trying to rupture anyone's bladder. You are also not going to set up CBI until you're sure that that Foley's in the right place. Okay, because what if, I don't know, there's a false passage, or perhaps it's a difficult catheterization, maybe someone's got prostate issues, maybe you are not in the correct place, and then you start up a 3,000 milliliter bag of sterile water, or saline in some cases. You're going to have problems. You're going to have problems. So make sure you irrigate first, make sure you're in the right spot, and make sure before you go in to do this that your other patients and your coworkers know where you're going, because like I said, you're going to be gone for at least 20-30 minutes. And if you have to get blood work and do your CBI, you're going to be there for quite some time. My biggest tip, my biggest CBI tip, especially for ER nurses, ready? Use all the urinals, okay, or hats. And I keep them all as I'm emptying those bags. And there's a reason. I actually tell the family and patient why I'm keeping all this in the room. It's not to scare them or make them see all this, because I guarantee you, if you have nothing to show and you tell, you're attending when they come in the room, yeah, I flushed, we did, let's say 4 bags. We did 12,000 cc's, okay? And it's still pink. And you have that one urinal of still pink urine. They're going to say, oh, okay. But if they walk in and they see 8 urinals that are all ranging in color, from Merlot colored urine all the way to your fruit punch colored urine to your clear urine, they can really see the progression of what has been happening and the effectiveness or ineffectiveness of your CBI. All right, I feel like handing them that one year, oh, this is what it looks like now. It was really red. It was cloudy. No. Show them, this is the first bag I emptied. You can see how thick it is. It's thick. It's Merlot in color. It's very viscous. In here, 3 urinals down, my 4th empty, you can see now we're becoming more of like a Hawaiian punch colored urine. There's no clots. Oh, in here, 3. Let them see. Okay, I've done both, and they need that shock value sometimes to walk in the room and say, oh, wow, they need to know you've been working. You've been in there working. The patient has worked hard to produce all of this watery urine, and damn it, they're going to see it. All right, so big tip, ER nurses, I know we're in such a rush and we want to keep everything clean. We're always trying to discard. CBI, give and especially if urology is coming to consult your patient, make it look like it was. All right, this is hard work for that patient. It's a bloody scene. It's rough, okay? Let that urologist walk in and see your 8 to 10, your 12 urinals sitting up there in varying color, so they can actually see the progression of what has happened with the irrigation of that patient's bladder. I think it really helps. It helps with treatment. It helps with pain management. And it actually helps the patient see exactly what's going on too. They're seeing that you're getting out what you're putting in. Make sure, of course, you're recording your CBI, and explain to the patient and the family what's going on, because it is very scary to see, dad's or your husband's genitalia getting pulverized. It's a rough procedure. We're sticking that Foley in, and we are just filling you up with a lot of water, and it's a lot of people's worst nightmare. So make sure you're explaining everything you're doing. Make sure you're explaining you're not keeping all this urine, bloody urine here for them to look at, and you're not lazy or nasty and keeping it in the room. You're keeping it there so your ED attending and your urologist can see exactly what has come out of that irrigation. All right. That's it. Have a wonderful day. I'll be back soon. Looking forward to hearing your comments and questions below. Let's talk about rates. What can we do? Do we unionize travelers? What do we do? How do we get it together so that they stop messing with us and making us so damn disposable? It's insulting. All right. Cheers.